This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Eliquis 2.5mg tablet is an anticoagulant used to prevent and manage blood clots in various conditions. Indications and uses. This medication is indicated for the management of blood clots formed in the veins of the legs and for preventing the formation of clots in patients with an irregular heartbeat. It is also used to treat and prevent the recurrence of blood clots in individuals diagnosed with deep vein thrombosis or pulmonary embolism, particularly following hip or knee replacement surgeries. How it works. Eliquis works by blocking factor XA, a crucial component in the blood clotting process, thereby preventing the formation of clots. Directions for use. Take the medication as prescribed by your physician. It should be swallowed whole with a glass of water. If you have trouble swallowing, consult your doctor for alternative administration methods. Your healthcare provider will determine the appropriate dosage and duration based on your individual health condition and needs. Possible side effects. Common side effects may include bleeding, bruising, anemia, low blood pressure, and nausea. Severe side effects warrant immediate medical attention. Precautions and warnings. Patients should be cautious when taking this medication, especially if they have pre-existing liver, kidney, or heart conditions. It is contraindicated in pregnant women and those with specific bleeding disorders. Always inform your healthcare provider of any medications you are currently taking to avoid potential interactions. FAQs. 1. Is Eliquis a blood thinner? Yes, Eliquis is an anticoagulant that helps manage blood clot formation. 2. What precautions should I take? Inform your doctor about any pre-existing conditions, especially related to bleeding. 3. What if I forget a dose? Take it as soon as you remember and continue with your regular schedule. 4. Can it cause low blood pressure? Yes, low blood pressure is a common side effect. 5. Is it safe during pregnancy? It is not recommended during pregnancy. Consult your doctor. Thank you for watching. If you have any questions or suggestions, please leave your comments below.